So now that I think I want therapy, how do I even find a therapist? Let's get into that topic. Hi, my name is Angela Ariano. I am a licensed marriage and family therapist, and I practice in the state of California. I say this to let you know that most of what I'm saying applies to California laws and health systems. I also want to kind of give this little caveat that this is just general educational purposes. This is not full concept of, yes, this is how it is. Insurance coverages, therapy practices, and license rules can be very different and varying. This is just within my experience of helping myself, friends, family members, or even clients get connected to a clinician. So please don't take this as absolute truth. This is just little tips maybe that you can take to help you find the therapist that you need. So there's only a few options that you can do into this. The first one is really just go directly to your insurance. You can call them, and hopefully every insurance, get your little card out, they have a number, and you can call them. Let them know, hey, I'm really struggling emotionally. I would love to get into therapy. From there, it's going to be different. Some might say, oh yeah, we actually have a program. We'll get you connected with it. Most insurances can and will pay for mental health. It's just not kind of written there. You got to kind of advocate. Advocacy is the biggest rule or word to keep in mind when it comes to finding a therapist. You've got to advocate for yourself a lot. So call your insurance, see what they say. They might want you to talk with like your personal care provider, mainly your general doctor. Maybe make an appointment. It is frustrating because it's one more step and it delays you getting into therapy. But sometimes unfortunately, it's a step we have to take. I've had to take this step myself when trying to find a therapist, and it worked out. It's just a little bit more work. And it's unfortunately just the way our system works. Let's say you don't have insurance or your provider doesn't really pay for it. You can call the number 211. They also have a website, just 211.com, and they can help you find maybe programs that can help, sometimes like free or pretty cheap therapy. Just give them a call, let them know what you need, go to the website. It's pretty user-friendly and can really help you see what is there for you to have. Another option you can take is to kind of cut out the middleman of your insurance. Let's say you've read your policy and you're like, oh yeah, they'll pay for my insurance or they'll pay for my therapy. Cool. Go to platforms such as Psychology Today. I have a profile on Psychology Today. What I have on there is the modalities that I use, where I'm located, if I do in-person or remote, and then the insurances that I take. Find a therapist that works for you. This is great because you can kind of find, oh, I really want a male therapist, a female therapist, a non-binary therapist. All of them are on there. They include their modalities, and you can just get a vibe for who they are. Then you can just, on that website, they have different ways. You can email them, you can text them, you can call them, and from there, that therapist should be able to just help you go, hey, use this link, or I'll email you and we'll get you set up with that. Another option you can take, which is probably the easiest, but possibly the most expensive, if not literally the most expensive way to do it, is to just do private pay, which means pay out of pocket. This can be expensive. Although I'll get into it in just a minute. Actually, I'll just get into it right now. You can see there's different types of therapists you can see in all different ways. But some of the categories would be a licensed therapist. I'm licensed. That means I've done my education. We have to do a certain amount of hours with supervision, and then we take our licensing test. So I'm a licensed therapist. But in order to be licensed, like I just said, you have to get your education and your hours done. So a licensed therapist might be more expensive. A pre-licensed therapist, such as an intern or a trainee, they're going to be a little bit cheaper. So I would encourage you to see one of them. A lot of people say, I only want to see a licensed therapist. They know what they're doing. I actually read a research, and I cannot tell you any of the context of it, so take that for what it is. But I did read an article that stated pre-licensed or new therapists are actually better than more seasoned therapists because their training is fresh in their brain, they're being supervised, they're doing the best they can to be a great therapist. So consider finding pre-licensed clinicians that are willing to do it. Some universities also have a lot of these students on campus, students or pre-licensed people. Some of those universities are willing to take people outside of the university to see. So that's a place you can go to. All in all, just finding a therapist is really hard, and it takes time, and it can be really confusing and frustrating. Like I said, advocate, advocate, advocate for yourself, because there are different ways to do it. You just kind of got to put in a lot of the work, unfortunately. Call your insurance, call 211, go to Psychology Today. Those are the best ways you can go to. Let's get into maybe another day on finding the therapist that's right for you. That might be another great topic to get into. This platform for me is really just to help people be able to know, is therapy right for me? How do I find a therapist? And then just getting to topics of like, what do I talk about in therapy? Or how do I approach my clinician for this? I am not wanting to, which are great things that other clinicians do, but it's just not where I'm wanting to go of help people get a diagnosis, give any therapy tips and tricks. I don't know if that's the right word for it, but that's what we'll just call it. I just want to help kind of normalize, destigmatize, and kind of decrease that like fear that some of us have even going into therapy. Well, I don't know, maybe my problems aren't that bad. So try all these things out if you're trying to find a therapist. See what works for you. Actually, I think 211 is outside in any state, but I'm not sure. So these are just California ways. Hopefully you'll be able to find a therapist that works for you, or any type of way that can improve your mental health, decrease your depression and anxiety. Thank you.